What is coronaviruses? The name for this kind of virus comes from the crown-like spikes it has its surface. Corona is a Latin word for crown. Coronaviruses are viruses in the subfamily of Orthocoronavirinae, in the family Coronaviridae, in the order Nidovirales. Coronaviruses are enveloped viruses with a positive single-stranded RNA genome and nucleocapsid of helical symmetry. The genomic size of coronaviruses ranges from approximately 26 to 32 kilobases, the largest for an RNA. Coronaviruses are a large group of viruses that infect mostly bats, pigs, and small mammals. In rare cases, they are what scientists call zoonotic, meaning they can be transmitted from animals to humans, humans to humans, according to the U.S. Center for Disease Control Prevention. Wuhan, the sprawling capital of central China's Yubei province, is a commercial center divided by the Yangtze and Han rivers. The city is the epicenter of the coronaviruses. The 2019-2020 China pneumonia outbreak in Wuhan was traced to a novel coronaviruses, which is labeled as 2019 nCoV by WHO. Symptoms of coronaviruses. The viruses can make people sick, usually mild to moderate upper respiratory tract illness, similar to a common cold. Coronaviruses symptoms include a runny nose, cough, sore throat, possibly a headache, and maybe a fever, which can last for a couple of days. How does it spread? Like other coronaviruses, such as the common cold, the virus is spread via droplets when a person coughs or sneezes. It can also be spread when someone touches a contaminated surface, such as the door handle. Hospitals are also key locations for super spreading events when a single patient infects many people. The outbreak originates from animals and the source is thought to be a seafood market in Wuhan, which also traded in other live animals such as mammoths and bats. How to prevent coronavirus? There is no vaccine to protect against this family of viruses, at least not yet. Trials for a MERS vaccine are underway. The U.S. National Institutes of Health is working on a vaccine against the new virus, but it will be months until clinical trials get underway and more than a year until it might become available. You may be able to reduce your risk of infection by avoiding people who are sick. Try to avoid touching your eyes, nose, and mouth. Wash your hands often with soap and water and for at least 20 seconds or more. Wear masks especially when you go out, and bring hand sanitizer or alcohol with you. If you are sick and have reason to believe it might be the Wuhan coronavirus due to travel to the region or coming into contact with someone who has been there, you should let a health care provider know and seek treatment early. Cover your mouth and nose when you cough or sneeze, and disinfect the objects and surfaces you touch. Be aware of symptoms and avoid living in animal markets, which is where the latest outbreak began in Wuhan. Awareness is the key. Prevention is better than cure.